Are you perhaps a little concerned about your kidney health, but you're not quite sure what signs you should be looking out for? Well, you're not alone. Many people actually overlook the earliest warnings of kidney issues simply because they can be incredibly subtle. But here's the good news. Recognizing these quiet signals can lead to early action and ultimately better health. So, today, we're going to help you understand these gentle nudges your body might be sending, offering some clarity and hope for protecting those vital kidneys. You see, even subtle changes in your body might be trying to tell you that your creatinine levels are elevated, and that's a key marker for kidney health. While really obvious symptoms often point to more advanced kidney issues, the early stages can present with mild, easy-to-miss signs. And that's why recognizing these subtle symptoms is so important. It can lead to early detection and prompt treatment, which can go a long way in protecting your long-term health. Number 1, fatigue and unusual tiredness. All right, kicking things off with our first subtle symptom. Number 1, fatigue and unusual tiredness. Now, this is one of the most common signs, yet it's so often dismissed, that pervasive sense of fatigue and unusual tiredness. You see, when your kidneys aren't functioning at their best, creatinine, which is a waste product from muscle metabolism, can start to accumulate in your blood. This buildup is a direct signal that your kidneys are having a tough time filtering out waste effectively. And there's more. Your kidneys also play a part in producing erythropoietin. That's a hormone that encourages red blood cell production. So, if kidney function is impaired, you might have lower levels of this hormone, leading to fewer red blood cells to carry oxygen. This condition is known as anemia, and it's a major reason why you might feel so tired. It's really important to distinguish this kind of fatigue from the normal tiredness you might feel after a really strenuous day or maybe a poor night's sleep. Creatinine-related fatigue often feels much more profound and persistent. It's a kind of weariness that doesn't typically get much better, even with rest. You might find yourself feeling exhausted even after a full night's sleep, or perhaps lacking the energy for daily activities that you used to handle with no problem at all. This isn't just about feeling a bit sleepy. It's a deep-seated lack of energy that can genuinely impact your quality of life, making even simple tasks feel like a huge effort. So, what's happening here? Well, the buildup of toxins and impurities in your blood, all because of reduced kidney function, directly hits your overall energy levels. Think of your body as a finely tuned machine. If the waste removal system gets clogged, the entire machine slows down and becomes less efficient. These toxins can interfere with various bodily processes, leading to a general feeling of malaise and exhaustion. Your muscles might feel heavy. Your mind might feel sluggish. All of these things contribute to this overwhelming sense of tiredness that, unfortunately, simple rest just can't seem to fix. Recognizing this distinct type of fatigue is so crucial for seeking timely medical advice. So, this persistent lack of energy truly can be an early whisper from your body that something isn't quite right. But fatigue isn't the only subtle sign out there. Sometimes, your body signals kidney concerns in ways you can actually physically see. And that's exactly what we're going to explore next. Number 2, mild swelling in hands, ankles, or feet. Moving on to number 2, which is mild swelling in hands, ankles, or feet. This is another subtle clue that your creatinine levels might be on the rise. We're talking about the appearance of mild swelling, or edema, as it's known medically, particularly in your hands, ankles, or feet. This fluid retention often acts as an early warning sign that your kidneys aren't filtering fluids and waste products as efficiently as they should be. When your kidneys are compromised, they can struggle to remove excess sodium and water from your body, and that leads to fluid building up in your tissues. This can actually be one of the first visible clues that your kidney function is starting to decline. Now, it's key to distinguish this subtle swelling from the kind of routine puffiness you might get after standing for a long time or perhaps after eating a lot of salty foods. Swelling that's related to kidney issues tends to be more persistent. You might notice your rings feeling a bit tighter, or maybe your shoes don't fit as comfortably as they used to. You might even see indentations left on your skin after pressing gently on the swollen area. That's called pitting edema. This type of swelling might be more noticeable towards the end of the day or after you've been inactive for a while. And often, it starts as a very gentle, almost unnoticeable increase in size. So, why does this swelling happen? Well, it's directly linked to the kidney's main job, maintaining fluid and electrolyte balance. Healthy kidneys are like sophisticated filters, removing waste products and excess fluid from your blood, which then gets excreted as urine. But when kidney function is impaired, this filtering process becomes less effective. As a result, sodium, which plays a really crucial role in fluid balance, can build up in the body. This causes water to be retained in the tissues, and that leads to the characteristic swelling in your hands, ankles, or feet. If you do notice changes like these, it's a signal your body is sending that definitely warrants some attention. So, while swelling can certainly be a visible sign, changes in what you can't always see, like your urine, can also tell a very important story about your kidney health. Let's take a closer look at what your urine might be revealing. Number 3, subtle changes in urine output or appearance. Our third point to consider is number 3, subtle changes in urine output or appearance. Paying attention to subtle changes in how much urine you're passing or what it looks like can give you vital clues about your kidney health and potentially elevated creatinine levels. Now, a normal urine output can vary quite a bit depending on how much fluid you drink, your activity level, and even the climate. But generally speaking, adults produce about 1.5 to 2 liters of urine per day. Any significant deviations from what's normal for you, especially if they're unexplained, really shouldn't be ignored. Remember, your kidneys are responsible for producing urine to get rid of waste, so any alterations in your urination patterns often reflect changes in kidney function. For instance, slight decreases in the amount of urine you pass, or urinating less frequently, even when you're drinking a normal amount of fluids, can be subtle red flags. On the flip side, some people might actually experience an increase in urination, especially at night. That's called nocturia, and this can happen as the kidney's ability to concentrate urine diminishes. Changes in the appearance of your urine are also really noteworthy. If your urine is consistently darker than usual, even when you're well hydrated, or if it appears foamy or bubbly, which can indicate protein in the urine, a sign of kidney damage, that certainly warrants investigation. And of course, blood in the urine, or hematuria, even just a small amount that gives it a pinkish or brownish tinge, is a serious sign. The connection between your kidney function and these urinary changes is both direct and significant. Your kidneys regulate your body's fluid balance and filter waste products from your blood to create urine. So, if kidney function declines, their ability to perform these tasks efficiently is compromised. For example, if the tiny filters in your kidneys, called glomeruli, are damaged, they might allow protein or blood cells to leak into your urine. Reduced filtering capacity can also lead to decreased urine output or, perhaps paradoxically, an inability to concentrate urine effectively, which would lead to more frequent dilute urination. Paying close attention to these subtle shifts can definitely lead to earlier detection of potential kidney problems. Now, beyond what you might observe in the bathroom, how you feel around mealtimes can also be an indicator of what's going on. So next up, let's discuss how your appetite might be affected by your kidney health. Number 4, loss of appetite or mild digestive upset. All right, let's talk about number 4, which is loss of appetite or mild digestive upset. It turns out that changes in your appetite or experiencing some mild digestive upset can sometimes go hand in hand with declining kidney function and those elevated creatinine levels. When your kidneys aren't filtering waste products effectively, toxins can build up in your bloodstream. This condition is known as uremia. This accumulation can affect various systems in your body, including your digestive system, and that can lead to a diminished desire to eat or other kinds of gastrointestinal discomforts. Often, these symptoms are quite subtle at first and can easily be chalked up to other causes. For example, you might notice a bit of mild nausea, particularly in the morning, or perhaps a general aversion to food, especially protein-rich foods like meat. Some people even experience an unpleasant metallic taste in their mouth, which can naturally make food seem pretty unappetizing. And if your appetite has been consistently poor, you might even experience some unexplained weight loss, even if it's just slight. These digestive symptoms pop up because the buildup of uremic toxins can irritate the lining of your stomach and intestines. Plus, they can also affect the part of your brain that controls appetite and nausea. It's really important to consider these symptoms as significant if they persist, or if they can't be explained by other factors, like a temporary stomach bug or stress. While an occasional loss of appetite or a bit of mild nausea can be perfectly normal, ongoing issues that lead to changes in your eating habits or your weight should definitely prompt a discussion with your healthcare provider. It can even be helpful to keep a diary of these symptoms, noting when they occur and how severe they are. This information can be really valuable for your doctor to assess whether they might be linked to kidney dysfunction. And just as these toxins can affect your digestion, they can also start to cloud your thinking. So, let's now delve into how elevated creatinine might impact your mental clarity. Number 5, trouble concentrating or mild brain fog. This brings us to number 5, trouble concentrating or mild brain fog. So, if you've been finding it increasingly difficult to concentrate, or if you're experiencing a persistent sense of mild brain fog, it could actually be a subtle sign related to your kidney health and elevated creatinine. Here's why. When waste products, including urea and other toxins, build up in your blood because of impaired kidney function, they can cross the blood-brain barrier and affect how your brain functions. This neurotoxic effect can show up as difficulties with focus, memory, and overall mental sharpness. What's tricky is that these cognitive changes are often quite gradual and can easily be dismissed as just normal aging or stress. The early cognitive changes that are linked to kidney decline can indeed be very subtle. You might find yourself getting easily distracted, perhaps struggling to follow conversations, or having a bit more trouble remembering names or recent events. Decision-making might feel more challenging than usual, and you could experience a general lack of mental clarity that makes complex tasks feel pretty overwhelming. Now, this isn't dementia, but rather a kind of dulling of cognitive function that can impact your daily productivity and your overall sense of well-being. It's really the body's way of signaling that something is interfering with its normal operations. Of course, brain fog can have many different causes, including things like lack of sleep, stress, nutritional deficiencies, or other medical conditions. So, it's really important to consider the context of these symptoms. If this brain fog is accompanied by other potential signs of kidney issues that we've talked about, or if it's a new and persistent problem without a clear explanation, then it's definitely worth discussing with your doctor. Ruling out other causes is essential, but so is considering the possibility that your kidneys might just be playing a role in these cognitive disturbances. It's interesting how interconnected everything is. Your skin, for example, can also reflect your internal health, and kidney issues are certainly no exception to that. So, next up, let's explore how your skin might be sending you signals. Number 6, itching or mild skin changes. Let's look at number 6, which is itching or mild skin changes. You might be surprised to learn that subtle skin issues, like persistent itching or other mild changes, can be an unexpected sign that your creatinine levels are elevated and your kidneys aren't functioning at their best. When the kidneys can't effectively filter waste from your blood, substances like urea and phosphorus can start to accumulate. High levels of phosphorus, in particular, can lead to itchy skin. The medical term for this is pruritus. This itching can be widespread or just in certain areas, and frustratingly, it's often not relieved by typical remedies. The itching that's associated with kidney issues, sometimes called uremic pruritus, can be really quite bothersome. It might be more pronounced on your back, chest, head, or limbs, and it can range from just a mild annoyance to severe discomfort that really disrupts your sleep and daily activities. And besides itching, you might also notice that your skin has become unusually dry, or perhaps it has taken on a grayish or yellowish hue. This can be due to the buildup of pigments that healthy kidneys would normally excrete. These skin changes happen because those waste products in the blood can irritate nerve endings in your skin and disrupt its normal function and appearance. Now, while occasional dry or itchy skin is pretty common, especially in certain weather conditions or due to allergies, persistent itching that occurs without an obvious rash or skin condition, particularly if it's accompanied by some of the other subtle symptoms we've been discussing, should definitely be a cause for concern. If you find yourself constantly scratching, or if your skin's texture or color has changed noticeably, it's really wise to consult your doctor to explore potential underlying causes, and that includes checking your kidney function. And finally, believe it or not, even your breathing can be affected by early kidney concerns. So, let's examine how shortness of breath might be linked to elevated creatinine. Number 7, shortness of breath or mild chest discomfort. This brings us to our 7th and final subtle symptom. Number 7, shortness of breath or mild chest discomfort. Experiencing shortness of breath or some mild chest discomfort can sometimes be an early indicator of fluid buildup that's related to kidney issues and elevated creatinine. You see, when your kidneys aren't effectively removing excess fluid from your body, this fluid can accumulate in various places, including your lungs. This condition, known as pulmonary edema, can make it difficult to breathe, especially when you're lying down or exerting yourself. And remember anemia, which we mentioned earlier as another common complication of kidney disease due to reduced erythropoietin production. That can also contribute to shortness of breath because there are simply fewer red blood cells to carry oxygen to your tissues. It's really crucial to differentiate this type of breathlessness from other causes, such as asthma, allergies, or common respiratory infections. Shortness of breath that's related to kidney problems might develop quite gradually, and initially, you might only notice it during physical activity. You might find yourself getting winded more easily than before, or perhaps needing to prop yourself up with pillows at night to breathe comfortably. And it's so important to remember that any chest discomfort, even if it's mild, should always be taken seriously. It could indicate fluid around the heart, that's called pericardial effusion, or it could be related to associated cardiovascular issues, which are unfortunately common in people with kidney disease. Now, while these mild symptoms might seem easy to dismiss, they can quickly become a cause for immediate concern if they worsen suddenly or if they're accompanied by other serious signs like chest pain, palpitations, or severe difficulty breathing. If you experience any new or unexplained shortness of breath or chest discomfort, seeking prompt medical evaluation is absolutely essential to determine the cause and receive the appropriate care. These symptoms really highlight just how interconnected our bodily systems are and why kidney health is so incredibly vital. So, we've walked through 7 subtle signs, and understanding each of them is important. But it's equally crucial to grasp why even the mildest of these symptoms truly warrant your attention. Why subtle symptoms matter. Let's talk about why subtle symptoms matter. Ignoring those mild or vague signs, like persistent fatigue or just a little bit of slight swelling, might seem harmless. But when it comes to your kidney health, these subtle whispers from your body can actually be early warnings of elevated creatinine and declining kidney function. The real danger here lies in the fact that kidney disease often progresses silently in its initial stages. This means that by the time more obvious symptoms finally appear, significant kidney damage may have already occurred. That's why recognizing these early nuanced indicators is so crucial for proactive health management. I really can't overstate the importance of regular screening, especially if you have risk factors for kidney disease, things like diabetes, high blood pressure, or a family history of kidney problems. If you do notice any persistent or concerning symptoms, getting a prompt medical evaluation is key. This allows for early detection through simple blood and urine tests that measure creatinine levels and other markers of kidney function. And the good news is that early intervention can significantly slow the progression of kidney disease, prevent complications, and truly improve your long-term health outcomes. So please, don't dismiss what your body might be trying to tell you. When to see a doctor. So, the big question, when to see a doctor? Well, if you experience any of the symptoms we've discussed, like ongoing fatigue, unexplained swelling, changes in your urination, or that persistent brain fog, and these symptoms are persistent, or they seem to worsen over time, it's really important to schedule an appointment with your doctor. Please, don't wait for symptoms to become severe. Your doctor can help determine if these signs are related to kidney issues or perhaps another underlying condition. Now, there are certain signs that require more urgent medical attention. If you experience severe or sudden swelling, significant chest pain or pressure, a sudden onset of extreme fatigue or weakness, or a dramatic change in your urine output, you should seek urgent care immediately. These could indicate a more acute kidney problem or other serious medical conditions. A timely diagnosis, often confirmed through blood tests like serum creatinine and what's called the estimated glomerular filtration rate, and urine tests that check for protein or blood, is absolutely key to effective management and treatment. So, to wrap things up, spotting these subtle symptoms of elevated creatinine, everything from that unusual tiredness to mild skin changes, can be absolutely crucial for early intervention in your kidney health. Addressing potential kidney issues when they're just in their beginning stages often leads to much better long-term outcomes, helps manage complications more effectively, and can significantly improve your overall quality of life. And finally, if you or someone you know experiences these subtle symptoms, please do not ignore them. We encourage you to share this information with your friends and family to help raise awareness about the early signs of kidney changes. For more valuable health insights, do consider subscribing. And of course, feel free to join the conversation by commenting below if you've noticed any early signs yourself or if you have any questions.